I'm Dr. Christopher Barker, and welcome to Holding Space. I will be holding space today for a discussion on autism spectrum disorders and some of the factors that go into that. That's a sort of a controversial topic right now, but one that definitely a lot of people are interested in. Again, I'm not a biologist. I'm not an MD. I'm a psychologist, and I do work with some people who have autism spectrum disorders. And again, it is a spectrum, as we've discussed about some other disorders, in that it goes from extremely severe to barely noticeable. And the only thing that I can say in terms of how you can be diagnosed that way, usually a neurologist can do that. A psychologist can work with you on adjusting to working with this. But the way that I see it is usually someone will come in who's already been previously diagnosed, and we will try to find a better way of living with it. That is a topic for another time. I wanted to look into some of the background and some of the potential reasons that a person might develop autism. I know that's kind of in the news these days. And so, ripped from the headlines, as I would say in Law and Order, we want to take a look at what might be considered causes. Um, at best, so far, we have correlations. Nobody has come up with 100% foolproof proof of what is a cause. And the thing about correlations is you have to. I went ahead and started drawing this out on the board, me and my whiteboard again. Let's say because it's fall now, it's autumn, and in the autumn, leaves start changing colors and people put on their jackets. School starts. So is it school starting that causes fall? Is it putting on your jacket that causes fall? Is it leaves turning that cause fall? I mean, if you want to look at which one of these things might be a causation, I don't think any one by itself. And if you put two of them together, let's say you have leaves and jackets, does that mean it's going to be more fall? No. Maybe there's another factor. Maybe cold weather causes all these, and that happens in the fall. And that's a problem with correlations. And that's one reason why I know we talked on another episode about taking research methods over and over again. That's one of the reasons why we do take research methods is we need to look at things from a critical perspective. We need to take a long range view and put a lot of thought into why we are drawing conclusions about things. The Human Genome Project has been really useful in trying to identify some factors behind bipolar disorder, schizophrenia, some of the more severe psychiatric disorders. But again, although we can say, yeah, this seems to be heritable because it does seem to be handed down from generation to generation, pointing to a specific gene and being able to make a change on that level is, we can't. There's no really good, reliable. I mean, we have medication that treats symptoms and can intervene in some of the neurochemical processes. But back to autism, there is there are some genetic mutations. Hundreds of genes have been implicated, including SHANK2, FMR1. These are mutations that can be inherited or they can occur spontaneously. And sometimes a genetic mutation can happen within a single generation and they get passed down. There are copy number variations. Structural changes in DNA, like deletions or depletions, seem to be common with people with autism. Again, technical stuff, but there is a genetic component to it. Same mutation can result in different outcomes, meaning that you can have some carriers who show barely autistic traits and some who show more severe autistic traits. So again, if we want to look at like what causes one particular thing, it's hard to say. But some of those correlations, prenatal factors, the literature says advanced parental age, maternal infections, diabetes, preterm birth have been associated with autism risk. That does not necessarily mean that if you're older, if you have what they are calling geriatric pregnancies, which is a little disturbing, considering it can be anybody over 30, really, in some doctors' opinions. Not every single case is going to result in autism or in severe autism, or even in what we used to call Asperger's syndrome. Chemical exposures. Some studies have explored links to air pollutants, pesticides, endocrine disrupting chemicals, but again, the findings are mixed. We haven't found a one-to-one correlation. Medication during pregnancy. There's controversy recently considering Tylenol, but large scale studies, there was one with studying 2.4 million births in Sweden, found no causal relation with acetaminophen. But again, might any chemical that is introduced somehow disrupt your genetic flow? Maybe. There's no way that we can 100% say that this thing is going to always happen. Autism is said to arise from atypical brain development, especially in the early fetal stages. Epigenetic mechanisms, there are changes in gene expression that cross generations. Again, we're looking at defective genes. There's always something new that's being discovered and discussed. One of the ways that we can figure, okay, so like, how can we study this? I mean, we were talking about a one-to-one sort of thing. Twin studies is one useful way of looking at it. If we have twins who are born to a parent with a carrier for a genetic disorder, both should develop it. If they do not, then you can start looking more closely at environmental factors. That's one of the main ways of looking at whether something is biological or not. And heritability studies using twins suggests that there's a 60 to 90% chance that it is heritable, that genetics does play a role. Now, are those genes altered before birth, or is that something that has been carried over from previous generations, like I said, epigenetically? Can't really tell for sure. You'd have to go back several generations. And again, the research is still fairly new, despite the fact that this is a disorder that's been around for quite a while. Also, there is the fact that perhaps we're seeing an increase in autism because more people are actually aware and coming in to get diagnosed. People who might previously have been seen as odd or having some sort of severe psychological disorder like schizophrenia, maybe it's worth a second look and see if that might be an autism type of disorder. Also, is it overdiagnosed? This one I have some feelings about because a lot of people are saying that, well, I think I have autism because I have trouble relating to people. Well, what does that mean, trouble relating to people? We hear about something and there's so many disorders out there and there's so many times that people are looking for what's wrong with me that they will grab hold of anything they can find. And autism, unfortunately, because it is so vague in some cases when you get into the less severe range of the spectrum, it might be easy to say that this is what I have. What are the implications for that? It might change the way you see your life. It might change the way you relate to partners. It might change the fact of whether or not you decide to have children, all because of something that you cannot be sure that you have. And if we are trying to be really careful about how we diagnose people, that's something that we really have to take a good hard look at. We have to err on the side of caution and say, is this something that is actually okay, or is this something that is abnormal? And I'm going to have to do a whole podcast on normalcy because, I mean, people use that term, am I normal or am I not? But normalcy is statistical. And if we want to look at it as what is normal, okay, here's the baseline. Here's the famous bell-shaped curve. The middle section of this being the largest number of people would be normal. And that's how we define normal as statistical. And mentally healthy is not necessarily normal. And if you have a whole society or a whole group of people who are functioning with a particular disorder, that might skew the the bell-shaped curve to one side. And that might become more like the normal. During the COVID pandemic, people who stayed at home and became isolated, that curve changed. And that became a new normal. So again, it's a statistical thing. And whether or not you are considered abnormal because of something that you're doing or saying, there is behavior that is outside the limits of normality that's at the far ends of these curves. And that might be considered abnormal behavior because it's not in here. And that does not necessarily mean it's bad or pathological. Again, I should just do a whole separate podcast on normality, but and what the heck that might be. But I wanted to introduce some ideas about autism and sort of like get some thoughts about it. So again, always feel free to write in, leave comments, questions, speculations. Please hit like and subscribe if you want to keep getting these. And if you have questions or if you have observations, please feel free to speak up. I try to answer as many, if not all, of the comments that I get. So it was nice holding space for you. Thank you for holding space with me, and we will see you again soon. Thanks.